Welcome to the next episode of Digital Health Insights from Stockholm.
Today we have Henrik Ahlén, who is a consultant, media expert, and also the founding member of Quantified Self Stockholm. Welcome, Henrik.
Thank you very much.
I know, Henrik, that you are very much interested in digital health. Can you explain us why is it so?
Yeah, well, healthcare systems all over the world are meeting big challenges now with the increasing demands from an aging population and also the rising costs. And everywhere, eHealth is seen as one of the key tools to meet those challenges. And I have a long track record in eHealth, so of course I see big opportunities for this.
Could you please tell us a bit more about Quantified Self in general and also Quantified Self Stockholm in particular?
Yeah, the Quantified Self is a global movement of people that like to track things and monitor themselves, both from physical and mental parts. And it's usually about life logging, where you use apps and sensors to monitor things about yourself and learn what works best for you. And this is, of course, a most important part of eHealth solutions too. The tagline for Quantified Self, I like it, is self-knowledge through numbers. And self-knowledge is, of course, the basis of all eHealth applications, where I, as a patient, can have this information to take much more active part in my own treatment and also learn what works best for me on an individual basis.
So, as you are saying, it's a lot of opportunities and benefits for you as an individual. But what are the challenges that digital health is now facing or might be facing in the future?
Well, the number one challenge in Sweden and in most other countries is the lack of reimbursement models. Where is the economy for it? There are no incentives for companies, whether it's from inside the healthcare organizations or from commercial entrepreneurs, so to say, to create new smart eHealth applications if they can't get any reimbursement, any payment for it. And today in Sweden, we are way behind many other countries. For example, even simple things like video meetings, where a patient can stay at home and have an online video meeting instead of having to visit the clinic. There's no way to get paid for that in Sweden yet. And in countries like the Netherlands and the US, this is used by lots and lots of people already.
So how would you think it's possible to deal with these problems and challenges?
Well, the problem with the reimbursement model, I think, needs two things immediately now. And the first one is to fix the current reimbursement system, to also add reimbursement for simple, basic things like video meetings and new apps that primary care doctors can use and so on. And the second thing is, my suggestion is that we create immediately a public fund where that will strive to develop new reimbursement models for those new types of eHealth services. And that fund should be directed at both the healthcare clinics themselves and also the developers, where the money mainly goes to the clinics so they can buy these services from eHealth developers. That would create real money in a real market, and that will be a catalyst for the whole development.
That's so great to hear about some suggestions in this area, which really requires some solutions to be made. And on continuing the positive note, we see a lot of investment in the area of digital health, a lot of new companies appearing. Based on your experience, what do you think are the success factors in this area?
I think venture capital have hesitated to invest in eHealth applications up until about 1-2 years ago, because they saw these problems with regulations and split markets with regions and different types of healthcare providers and of course the lack of reimbursement models. But now they have seen the enormous growth in sort of preventive health, in fitness. That whole sector for eHealth has exploded, and lots of venture capital goes in there too. And many of those actors in that field are now moving over to the eHealth sector. And even the old incumbents like the medtech companies and so on are also seeing these opportunities, especially for the care of chronically diseased people. So there's a growing interest, and there are also people are now experiencing good eHealth applications that are seen as useful and attractive to both healthcare staff and also the patients. So of course, if we fix the reimbursement and the economy behind it, we will see this grow into a very big business area.
That's very great.
Thanks a lot, Henrik, for your very wonderful insights, and we really hope that the reimbursement would get better by time here in Sweden and all over the world. So we'd like to thank you for tuning in, and we meet you in the next video.